Hi, this is Gemma from ASD Rocks, just sitting here with Philip Bliss, dentist of the stars being my two younger children, Bo and Finn, and wanting to get a professional opinion in regards to treating children with ASD. Very, very interesting one, which actually comes directly from one of our ASD Rocks viewers. Many of our younger people, in this case, this particular child is 12 years old, has an oral fixation and has from very, very young, chewing, grinding on anything they can get their hands on. In one particular evening at 12 years old, it was a sock.
Yeah.
So there's chewing and grinding. My question to you is, can there be specialised, obviously there's going to be an expense, but can there be specialised items created almost, well, I know that there can be a nighttime grinding something, I know that because you did that for me, but is there something almost that would give them like something a spring-loaded? I see those kids with braces, they seem to have elastic bands. It almost like built-in chewing gum or something that would give them that oral relief as well as fix.
You've got to be careful. And you're right, there is a fixation on grinding and chewing, and you can see that with a lot of patients because you often see children with splayed front teeth. So the grinding that occurs actually causes the teeth to spread a little bit.
Is that right?
And if it doesn't cause that, then you get excess wear.
Getting to the end of our interview, and I did mention before about a particular child who has a grinding issue. They took their child to the dentist. He was, I believe he's 12. He was given Valium and gas, and he still would not let the dentist near him. Now, my suggestion immediately was ditch that dentist and start afresh, and start with exactly what you had suggested, going up and down, not doing anything. But in extreme measures where you haven't got Valium and gas, I'd be pretty happy.
Sometimes it's not enough. The issue is twofold. One is whether it's an emergency type treatment. If the patient is in pain or having really difficult issues and the Valium and the sedation's not working, you have to have a general anaesthetic. No question about it.
I believe
and
this
you may not have time to do the niceties of 2 or 3 visits and building up the confidence. But you need to do that after the general anaesthetic and when the child's not in pain. If it's a routine treatment, totally different situation. It still may come down to the fact that that particular child is untreatable and may still need general anaesthetic. But it's not as often, it's not as needed as one would imagine if you
trust.
Absolutely. And the problem is that a lot of practitioners haven't got the time to devote to spending visit after visit not doing anything. And
find yourself one that does.
Absolutely. And one of the issues that I find a worry is many practitioners, many dentists do the general anaesthetic as a first option, and that doesn't help anybody.
Okay. So that's pretty much us done, and I thank you so much, and I'll be seeing you in May. Well, the boys will be anyway. Any advice that you have for ASD parents that you want to add your own 2 cents worth for anything?
No, I think you just have to shop around, find the dentist who you get on best with, who is tuned in, and a lot of dentists are tuned in.
These days with the explosion
absolutely,
since the 90s.
But yeah, I mean, find somebody who you can talk too easily, who's not rushing you through, or is prepared maybe to see you at the end of a day or end of a morning, so there's no conflict with keeping other patients waiting, which is always the issue.
And you
and
have
go on
never
recommendations.
Run off time. This is the only dentist
No,
I tell you, if your appointment is 10:02 in 53 seconds, you're ready at 10:02 in 53 seconds. It is amazing. So, all right, well, thank you so much. I really, really appreciate it. I really do.
Okay.
Because, and in fact, I know I'm going to be bombarded with questions I'm going to be emailing you with.
Well, I'll be more than delighted to answer them. And I don't know, maybe if there are a lot of other questions, we'll do another session in a few weeks and we can answer and go through those issues.
Well, I'm going, if it's okay with you, I'm going to bring my camera in with Bo next in May when he's due, and we'll just film the session about how comfortable he is with you now, because he does trust you so much, and there is a lot going on in that mouth of his right now. All right, thank you so much.
My pleasure.
Thank you.
Bye.
Bye.